Our guest today is Dr. Jacob Teitelbaum, who is one of the most frequently quoted integrative, pain, and fibromyalgia medical authorities in the world. Today, we are talking about antacids and acid reflux meds and the powerful herb curcumin. Which one is better for heartburn? Well, he is also the author of 10 books, including the best selling From Fatigue to Fantastic and the popular free smartphone app Cures A to Z. Well, he is the lead author of 8 studies on effective treatment for fibromyalgia and chronic fatigue syndrome. And Dr. Teitelbaum appears often as a guest on news and talk shows nationwide, including Good Morning America, CNN, and Fox News Health, to name a few. So, ladies and gentlemen, let's welcome back Dr. Jacob Teitelbaum to the show. Well, welcome.
Well, Ward, everybody, it's great to be with you again. And for those of you who have heartburn, we're going to teach you this is not too much stomach acid. Indigestion comes from poor digestion. We're going to teach you how to restore healthy digestion, how to get off these deadly antacid medications, such as Nexium and Prilosec, which are, in my opinion, quite dangerous, and how to live happily ever after. Not bad for 20 minutes.
That's it, because I understand that 60 million Americans who suffer from heartburn symptoms at least once a month, and then there's 15 million who suffer from heartburn every day. What is actually the main cause of this heartburn?
Well, what's happening is America's digestive system collectively is just out of whack. That's a lot because of food processing. There's two main things needed to digest food. You need stomach acid, which tends to decrease as we age, not increase. And a lot of indigestion is not enough stomach acid. So as the population ages, we see it. But also, the enzymes found in food digest the food. They also ripen the food, and the food processors learned if they destroy the enzymes in food, instead of a ear corn having a shelf life of 3 days, you have corn flakes with a shelf life of 3 millennia. So the food looks great, but it is indigestible because you don't have the enzymes you need. Your body will make some of those, but over time that also decreases. So those optimizing those two things will optimize digestion, and then giving your stomach what it needs to build that healthy barrier against the stomach acid so it doesn't get digested like that hamburger.
Yeah, I mean, and like you said, most of today's food that people eat lack the digestive enzymes. Because of the lack of enzymes, and people tend to eat more processed food, doesn't that put an undue burden upon the pancreas?
Absolutely. And the pancreas is getting a workout and possibly gets exhausted. We really don't know. We see with the adrenal stress handler, it gets exhausted, but not really much in the way of research about that. Um, but the thing is, you can replace it. There are foods like papaya and pineapple that are very high in digestive enzymes. Animal based digestive enzymes don't work worth a darn. Sorry. You have all these ones on the shelves. They have to be vegetarian. They work across a wide acid base, and clinically they work really well. With the animal-based ones, just don't. They work for inflammation. But just garnish your meals. Have a slice of papaya. Get some chopped up pineapple cubes. Cubes of pineapple, and have those with your meal. And you're going to see a major thing. And then add a little bit of apple cider vinegar, or better yet, a vinegar-based salad dressing. That will give you acid from the vinegar. So you have the enzymes, the acid, you have a very tasty plate in front of you. And again, you want to do this in a way that's fun. Otherwise, I'm not going to stick with it.
Well, that's true. Well, what are the symptoms of heartburn?
Well, if you're having trouble with the stomach itself getting digested, really, that's when you have pain in your solar plexus, right down in that right below the rib cage in the center. If it's down in there, or right down around that area, kind of a little boring pain, that's likely coming from the stomach. But if it bores all the way through the back, definitely get seen by a doctor. That may be pancreas. But once the burning is coming up your chest, you have burning and sometimes even refluxing into the throat. But the burning behind the chest, that goes away with a chewable antacid. And Rolaids is the best of the bunch. Tums is okay, but the Rolaids have magnesium. They're much safer, especially for men. If those symptoms go away when you do that, you confirm pretty much that it's acid reflux. So those two things, and irritation of the stomach or the acid squirting back into the unprotected food pipe will cause symptoms.
Well, I know that millions of people use antacids and then they use what we call PPI drugs, uh, which is what? Protease pump inhibitors. Did I say that
Mhm.
right?
Yeah,
For
mhm.
for
Yeah.
heartburn. So what are the actual downsides and the possible dangerous side effects of using these drugs?
Not much. You just have a 36% higher risk of Alzheimer's if you take it even for a short while. Market
36% increase of Alzheimer's?
Yeah, but who cares about that? That's good for businesses, and bone density shrinks horribly. It's horrible for osteoporosis. May well get depressed, may well get nerve pain. It's very nerve toxic. It basically destroys digestion. It's very, very addictive, but it's good for business. We don't care about the stuff because, you know, it's profitable.
Well,
Why
I
would we
also
care about
understand that
people?
it doubles the risk for colds and flu.
And it triples, just in the studies I've seen, I think tripled the risk of death or getting COVID. So your immune system goes down as well. The list goes on. We can talk all day about the wonderful side effects that are
Well,
so good
a
for the
lot
medical
of
business.
people, it's funny because people who take these things on a daily basis, I know people who are taking, let's say, a
Mhm.
B12 supplement. Um, but isn't that counterintuitive because B12 needs stomach acid to be
Yes.
digested?
It will cause vitamin B12 deficiency. It will cause magnesium deficiency. So it's good, I think, for most everybody in this country to take good multivitamin that's high in B12. I'm not talking about the RDA, ridiculous dietary allowance kind of things. There's a wonderful one called Clinical Essentials. It's the one that I use. It's 2 tablets a day. It'll have high levels of the B12. It'll have 150 of a really good magnesium. It'll have high levels of it's awesome. So I'm very picky
Yeah,
when it
I
comes to
am
that.
too, and I love the clinical essentials myself. And I
Mhm.
understand that there was a recent study comparing the herb turmeric, which contains the curcumin, and then the drug for heartburn. I believe that it's the one. Was it uh,
I think
Prilosec?
Prilosec,
Yeah.
yep. So here's a funny thing. Um, remember we talked about these medications, Prilosec, Nexium, these others are very, very addictive. What happens is the reason the stomach survives stomach acid itself is it makes this coating of mucus that the acid just keeps working on the mucus and it keeps putting out more mucus, more, so that the stomach acid I'm sorry, the acid never touches the stomach lining. Um, so the Prilosec turns off that mucus lining protection. It leaves your stomach totally bare and exposed while stopping the B12 absorption and iron and other problems. So and your stomach is pouring out a hormone called gastrin saying, make acid, we need stomach acid. So when you stop these medications, you have the Niagara Falls of stomach acid coming into an unprotected stomach, and people with no heartburn before they take the medication. In the studies, I showed this. Healthy people, 6 weeks later, they try to stop it suddenly. Oh my God, Um, so it's you need to switch, and we'll talk about that today. So a good place to begin is that the research shows that curcumin, which comes from turmeric, in a head-on study, was as effective as the Prilosec PPI medications after 6 weeks of use, which is amazing. So again, I don't recommend you stop those medicines suddenly, but that you start to wean. You take the form that I would take of the curcumin. It's called Curamed. Curamed. Write that down. Get 750 milligram capsules and take one twice a day. And then after about I would also take something called stomach and intestinal relief, basically DGL licorice, which increases that mucus production. So suddenly over 6 weeks, you're going to be restoring your mucus lining despite the Prilosec and Nexium medicines. You can start decreasing the dose, break the tablets, take smaller amounts as is comfortable. And sometimes you need one medicine to fight another. These other things are going to take over, but in the interim, you can switch to Pepcid, which is over the counter. It's safe. I prefer natural. We all do, but it's a helpful way to kick that Prilosec addiction safely. And then you can wean that one down. Meanwhile, the Curamed and the clinical essentials may restore what your brain needs to prevent that dementia damage uh, from the Prilosec. And in general, it's brain protective in many, 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 many ways. So, simple, simple things that you can do.
Yeah, it's amazing that, when I've read the directions, especially on the prescription anti-reflux medications, it always says use for 2 weeks and then reevaluate your
Mhm.
diet or go back to your doctor. But a lot of people never read the directions and they live on these things day in and day out. Uh,
Mhm.
with the let's use the curcumin for an example. How often during the day would you take it? Would you just take it after a meal, or can you take it prior to a meal?
I like people taking everything morning and night. When I brush my teeth is when I take my stuff. I don't want to be spending all day popping pills. So in the morning, I personally take Curamed myself because there's so many health benefits in terms of helping the immune system, preventing all the kind of things that come when the immune system are down, the brain protection, all these different benefits. I feel great, but I just can't justify to myself not taking one a day. So I take the 750 milligrams each morning just to stay feeling healthy. And I'm 31. I'd like to stay that way another 20 years. So Curamed, I think, helps that. So take it in the morning, take it at bedtime, take your stomach and intestinal relief, the DGL licorice. Some people take it around meals. I would just take it morning and nighttime because you want to build up that mucus lining. Let it sit in the stomach and do its job a little bit over there. And then the Rolaids can just be taken, and it's worth getting the Rolaids. Uh, Unfortunately, I don't know of any good natural chewable antacids. Well, they're all pretty natural except for the pretty colors they put in there with the chemicals. But um, and then you use Rolaids as needed, and those are like calcium and magnesium. So besides the additives, their core is pretty healthy. Tums is just calcium, which by itself, there's a, it's okay, but there's some risk of the calcium going to the wrong places in the blood vessels instead of turning off stomach acid. So the Rolaids, taking the multivitamin and the clinical essentials with the vitamin D. The vitamin D is a traffic cop that tells the calcium, okay, go where you belong instead of into the blood vessels. It's so it's this mix. Good multivitamin, everybody in this country should be on. The Curamed, I take myself just for general health. And then up it to twice a day if your stomach's giving you fits and you want to help it heal.
Well, I personally, and I take those exact supplements every day. And I agree
Uh-huh.
with you. Morning and night, why do you want to be popping pills all day long? So I
Mhm.
do the exact same thing you do. What I add, especially after a meal, I take a couple of chewable papaya tablets. Is that okay?
Absolutely. I find I live in Hawaii, so we just go to the tree and pick the papaya plant off it. I find that's even tastier. But if you don't happen to have a papaya tree like we did, hanging out, we had outside our house, then the papaya tablets are another way to do it. Again, the papaya and pineapple, very, very high in digestive enzymes.
Yeah, and that's what the bromelain.
Bromelain, exactly, very good, and papain, and the whole mix of them. And again, I know I said this before, but animal-based enzymes don't work. It took me 20 years to figure this out. They have these prescription high potency, and I never saw one person's digestion improve using these prescription enzymes. And then it was a chiropractor of all things. I went to one of his conferences, Dr. Loomis, and he said, "Well, you have to have the plant-based. The animals don't work because they don't work in pH range." And I said, yeah, whatever. But I tried it, and everybody. was coming back on the plant-based enzyme saying, "My digestion's so much better, doctor." So, it's, we're all students, we're all teachers, and the plant-based enzymes and a little bit of salad dressing will,
Well,
instead of the teaspoon of honey.
no, I 100% agree with you because uh, the uh, the animal-based pancreatic enzymes, we always had a problem with them, and like you said, it almost takes you 20 years to figure it out. But
Mhm,
when we, way back in the day when we were taking the pancreatic enzymes, like you said, being animal-based, sometimes they felt like they caused more of a stomach upset or nausea. Um, didn't really seem like they did the job great, but it was always the
mhm,
papaya chewable tablets, or like you said, a vegetable source digestive enzyme that always
mhm.
worked the best.
Absolutely. So you know now, improve your digestion. Go ahead and use uh, the papaya and the little bit of salad dressing. Go ahead and heal the stomach, heal the heartburn with the Curamed, and take the clinical essentials to really help restore your body from that. Again, the stomach intestinal relief. So this whole system, after about 6 weeks, you're going to feel so much better, and then you can start to wean off stuff after 6 to 8 weeks. Meanwhile, use the Pepsid to wean off of the Nexiums or Prilosec or those other things. Don't try to stop them suddenly. You will curse my name if you do that.
Well,
You know.
I remember, I believe it was our last interview when we talked about long COVID.
Mhm.
And you mentioned Pepsid, that it may actually boost immunity. How
It
is
does.
that?
Well, they're two totally different animals. The Pepsid hits the histamine system, which also is part of the immune system. And when I got COVID, I took my ivermectin, I took my Pepsid, I took a nice cup of tea and my Kindle, and I had a very pleasant 4 days in bed. The grandkids are here for 5 weeks. So I got 4 days to kind of relax, and it was wonderful. But the Pepsid is really helpful. I will note the medication metformin. I know we like natural stuff, but I'm going to mention some of the good guys. Taken in the first 5 days of COVID decreases the risk of long COVID by over 50%, over 60% from the first 4 days. So, for those of you out there who have CFS and fibromyalgia, are afraid of a flare, this is something I'm happy to write for the people I treat for them to have on hand to start if they get the COVID symptoms. COVID is not something to be frightened of unless for fun and profit. But in real life, it's just a matter of common sense. But should we talk also about the H. pylori? Because
Yes, yeah, I'm glad you brought up the H. pylori. So if someone is dealing with that, what should they do?
Okay, so here's the thing that this what we went over now will take care of most of you, but some of you will have an infection that thrives in a low acid environment. I'm sorry, in the acidic environment. So the H. pylori, and it's a stomach infection. Traditionally, they'll do testing for that. It's important to realize that half of the healthy population in the world is positive for H. pylori. The test being positive does not mean you have it or need treatment. Most doctors don't know that. But if you have severe persistent indigestion and the positive test, they'll give you the triple antibiotics and they'll give you the Prilosec, you know. You know. But here's another approach. You can go ahead and use limonene. It's called Heartburn Rescue. Limonene kills H. pylori. Uh, and it also has sea buckthorn oil, which helps the mucus lining reconstruct itself. So for those with severe cases where 6 weeks later it's still pouring at you in there in your solar plexus, heartburn rescue, add that in, give that 6 to 8 weeks. And also mastic gum you can find over the counter. That also can help kill the H. pylori.
I remember the mastic gum on the H. pylori DGL. And I was surprised, the D-limonene. I remember back in the day when it was just kind of people started kind of knowing about it, but still today a lot of people don't know about D-limonene working in
That's,
the
that's
digestive tract. And You come on here and you bring us an absolute great wealth of knowledge and wellness solutions, and I want to thank you for that.
Or honored to teach. And again, as the doctor, the medical profession has failed us. The medical profession, they're all nice people, but it's based on profit, not science, not even sanity, just profit. And so, what I'm trying to do, me and our small army of holistic doctors, is to get out the truthful information of what the science shows. And the thing is, you're not going to see it on places that have drug company advertising.
That's right.
Just they don't want to tick off their advertisers. So, Ward, thank you so much for the opportunity to teach and for me to help folks because as a doctor, that's what I'm here for.
Hey, I
So,
always enjoy having you on the show. And ladies and gentlemen, after the interview, we're going to put up on the screen all of Dr. Jacob Teitelbaum's recommendations. So if you're dealing with acid reflux and heartburn, we're going to have all that info as well as the H. pylori. We'll have all of his recommendations for that. And so that way, when they pop up on screen, if you need to pause it for a moment and write it all down, do that because this is information you need to have complete healing and improve your overall health and well-being. That's what we are here for on the Dr. Ward Bond Show. And again, it's always a pleasure to have Dr. Jacob Teitelbaum on the show. And I know for a fact we will have him back again and again and again. Doctor, aloha and mahalo. Did I say that right?
aloha, and you said it perfectly. And aloha, everybody, and have a wonderful, wonderful day.
All right, ladies and gentlemen, Dr. Jacob Teitelbaum. And as for myself, get ready. We're going to show you all of again, his recommendations for heartburn and acid reflux and the H. pylori. And I will be right back with more.
You have pain. From muscle pain to back pain, Curamed Acute Pain Relief has you covered. Curamed Acute Pain Relief is tough on pain, not on your stomach and liver. Our triple action pain formula is a breakthrough in pain relief in an easy to swallow liquid gel. Safe, effective. Love your results or your money back. Tackle your life again in no time.